Thank you, Linda. Part B of this. Now, it requires the health insurance policies to provide unlimited inpatient coverage for medically necessary treatment of substance abuse, correct?
It's already unlimited. Insurers already have to pay for that.
All right. Do we do anything to stop the requirement that insurance companies are giving people that you have to fail 3 times outpatient in order to go inpatient?
In 2014, we eliminated the fail first requirement.
Okay. Well, it's my understanding they're still doing that.
Well, they should be reported.
All right. Now, we also have they can prescribe, do we require? Now, do we require doctors to counsel their patients about opioid addictions in this? Bill?
In inpatient.
Okay. And now when they're prescribing opiates, do we require doctors to give them a non-opiate alternative when prescribing?
No, we do not.
Okay. All right, now we get to Part D.
Let me just expand on that. The purpose of the part of the bill that requires physician education will hopefully lead, and is intended to lead, to physicians not relying exclusively on mega doses of opioids. So hopefully they will learn to use other modalities in treating people with substance use disorders.
Okay. Now in Part D, where we give instructions to pharmacists, bill requires pharmacists to distribute different materials pertaining to opioid abuse?
Yes. You know, pharmacists play a critical role in educating consumers about prescription pain medications. And pharmacists, and I've spoken to many of them who are very happy that they will play a part in educating consumers about the risk of addiction and available treatment resources.
Terrific. Now, one of the problems that we came across, and a lot of times out on the island, we do things where we take in old medication so people can drop it off. So there'll be a big event saying, bring your prescriptions here, your old prescriptions, we'll collect them. Okay, and that's been a big problem with especially teenagers, because they raid their drug cabinets and stuff in the bathrooms, and they're having pill parties and all this other stuff. And they're infrequent when we turn around and have these events. And the other thing that they do is you could drop it off at the police station or the jail.
Right.
And it's an inconvenience for people and a lot of people don't like to come in with a bunch of drugs in a bag to a police station or to go to a jail to drop them off. Do we do anything in here to entice pharmacists to have a receptacle to collect used prescriptions that are no longer needed?
In this bill, it mandates that procedures for safe disposal of unused controlled substances be explained to people receiving these prescriptions. In addition, the pharmacy can provide information regarding safe disposal, and the pharmacy can also go further. I think this is an idea whose implementation will be coming shortly.
Well, you would agree that, this would make it more convenient to people, their local pharmacists were to collect this.
Absolutely, and the use of leftover pills is what gets many people addicted to opioids. So I'm sure pharmacists are very happy to participate in prevention and education.
Okay. Thank you, Lynn. On the bill?
On the bill, sir.
Now, we have 3 bills that we're going to be talking about right now. And I will be supporting the legislation. It's a great first step in dealing with this problem. Unfortunately, it is only a mere baby step. Though we address a lot of issues, there are a lot of issues yet to address if we're going to take a hold of the problem. This has become a problem not only in the state of New York, but it's states around the country, to the point where it's even an international problem. So what I'm going to try to do, point out as we go through the different pieces of legislation, is where we've fallen short. And the purpose of this is to get other people to look at what we're pointing out. We went out and did forums, and we did a report on this side of the aisle on heroin. And we listened to people, and we listened to the problems throughout the state. And though we've addressed some problems, we haven't addressed the lion's share of the problems. So what I'm trying to do here is point out the holes that we need to fill. And I appreciate the opportunity to do so on the floor. Thank you.